Good evening, everyone. Welcome to tonight's broadcast. We are here live from Bethel Church, and we're excited to share with you today in reference to a presentation on COVID-19 and the Pfizer vaccine, particularly as it relates to, again, youth ages 12 to 15. We're excited tonight. We welcome all those who are joining us on the various platforms, those who are joining in via conference call. We welcome you. Also, those of you who are joining in by way of Facebook and also on YouTube. We're excited to share tonight as our guest, and we're in for a phenomenal treat. Allow me just to read her bio and give you an idea who will be sharing with us tonight. Dr. Shaw is a board certified infectious disease specialist and has been with the Stanford Hospital and the medical group for over 8 years. She did her internal medicine training at the University of Pennsylvania, followed by an infectious disease fellowship at Columbia University Medical Center. She received a master's of epidemiology at Columbia University Mailman School of Public Health. She is currently the associate hospital epidemiologist and associate director of infectious disease at the Stanford Hospital. She is a member of the Alpha Omega Alpha Medical Honor Society since 2007, and she received the Rookie of the Year award from the Stanford Hospital Department of Internal Medicine during her first year as an attendee. She was awarded the President's Award for Young Professional Achievement in Medicine from the GOPIO organization in 2019, and she has recently received the Fairfield County Medical Association Most Valuable Physician Award in the end of 2020. That is amazing. She is an active member of the Chief Organization for Female Leaders and serves on numerous committees in the hospital as well as the state level. Amen. And so we're excited to welcome her to Bethel Church. And let me bring her on now and let her join in with us. All right. Welcome, Dr. Shaw. How are you doing this evening?
Thank you, Dr. Jackson. Thank you for having me. I'm doing well. I'm
Wonderful.
happy to share some information with your church.
Absolutely. And so, again, we welcome those persons who are visiting with us from maybe the Stanford Public Schools. We did send out communication via the Stanford Public Schools so they too could be a part of this broadcast tonight, as our goal and our push is to certainly provide information, allow you to make the best decision possible for you and your family. But we just want to give you some information tonight. And again, hopefully, if you feel compelled tonight, we will have an opportunity for you to sign up. I will share the link after this broadcast for those of you who are interested in receiving the vaccine, for those who are 12 to 15 and up. We're not just for children. Anyone as young as 12 could receive the vaccine here at Bethel Church on May the 22nd. So we're excited to continue offering our facility to make sure persons have the vaccine. Dr. Shaw, I told my congregation on Sunday that I have been playing multiple roles during this pandemic. I have 4 children ranging from ages 21 all the way to 1 year old. So I've had the Jackson University, I've had the Jackson Academy, high school, middle school, and Daddy's Daycare. And I said, I'm excited to share and also to be able to hopefully offer my children the vaccine so they can go back. We have done distant learning, and the principal, the dean, the substitute, I am tapped out. So I'm looking forward to my children receiving the vaccine, and also my wife will receive it as well. I've already received it already, so I'm excited to have this opportunity so that my children can be vaccinated and get back to normal, as we know, and particularly back to the Stanford Public Schools. So thank you so much again for joining us, and I'll let you begin in your own way. So again, welcome to our community tonight.
Great, thank you. And as a mom of 3, I completely relate, although my children are younger, so they're not yet eligible, but I share in your sentiment.
Yeah, thank you.
All right, so I'm going to share my screen and let's go over some slides. Okay.
Let me know when you're ready and I will add it to the screen.
Okay, it's up on my screen now.
Okay, wonderful.
All right, so I just want to talk to you all tonight, mainly just some updates on COVID and our numbers and how we're doing around the state, and then obviously really focus on the vaccination and this new authorization for ages 12 to 15. So just to give everyone a lay of the land, so to speak, this is, oh, sorry about that. This is where we stand in terms of our Connecticut COVID cases, our hospital census, and our mortality due to COVID. And what's nice to see along all of these graphs is that everything is coming down. Our cases are coming down, our hospitalizations due to COVID are coming down, and our deaths due to COVID are coming down very nicely. And it's a trend that we've been enjoying for the past few weeks. The Connecticut Department of Health publishes a daily positivity rate for COVID, which means the total number of positive COVID tests over the total number of tests that are being sent. And they update this number daily. It's running around 2.7%. We do the same at Stanford Hospital, and our positivity rate for last week was 2.1%. Those rates are low and have decreased over the past several weeks as well. And if you look at who's getting COVID in the state right now, this graph represents the breakdown of COVID rates by age group. And what I wanted to really point out here is that individuals aged 10 to 19 and 20 to 29 are the individuals that are at the top of this graph, meaning that they're the ones that were getting COVID the most. And now while all the trends are coming downwards, these are still, it's our younger folks that are more vulnerable to getting COVID. And a lot of that is due to the fact that, you know, many of them are not vaccinated. What's nice to see is the vulnerable population or our elderly individuals down here on the graph above 70. We're hardly seeing any COVID in this population, and that's largely due to vaccination efforts.
Doc, if I could just interject for a few,
Yeah.
if you could go back and just share about the 16, is that what I saw, the 16 to the 19-year-olds?
Yes, this one?
Yeah, so that's the millennials more or less that we're looking at. And I know, again, it's challenging, and I just want to echo what has been presented, but to say that I know it's challenging for that age group to remain social distance. I mean, they had to go through a lot, particularly those who are in high school, not having to participate in sports. Proms last year were canceled, graduation. And so as soon as some of the restrictions were lifted, they really went full-fledged. And I think as a result of that, that's why we had those increase in numbers, if I would say, just in terms of the COVID cases among that age group. So, and it is still real out here. It's still very much, you can get it. Absolutely.
Yeah, I agree. And that's why this authorization for 12 and above is so important, because if we can get, 12 and above vaccinated, I think that we'll make it safer for those age groups.
Absolutely.
And so similarly, if you look at the age groups of people being hospitalized in the state, that's what this graph shows. So this is the associated COVID-19 associated hospitalizations. And the red bar here is our older individuals, 65 and above, which has come down nicely over the course of the end of the winter and early spring. And you're seeing here what we were seeing before is this teal number here is age under the age of 50, that we saw an uptick in these hospitalizations in early April. And largely the patterns that we were seeing at Stanford Hospital was that it was individuals that were not vaccinated or incompletely vaccinated that were getting hospitalized. But thankfully, all of these numbers seem to be coming down. So In that same vein, how are we doing with vaccines across the state? I'm sure many of you are aware that Connecticut is really standing out nationally as one of the states that has vaccinated a lot of the population. Governor Lamont announced this past weekend that 70% of Connecticut residents have received at least one dose of the vaccine, which really puts us at the top 3 or 4 states in the country in terms of our vaccine uptake. But what's notable here in this graph is that this is the number of vaccinations given by week, and we saw this nice kind of rise in our vaccinations. This is starting from December when these vaccines came out, but now we're seeing a drop. And we're getting to a point in the state where our vaccine supply is outpacing demand. And so really now the focus is on getting to hard to reach groups, those who may be hesitant to get vaccine, or those who may not have access as easily to get to a vaccination site. And so that's where we're really focusing our efforts to get the remaining folks in the population vaccinated.
Mm.
So if you look at the coverage by age group, this is as of Monday. This is from the Department of Health. And it's nice again to see here in our older population, upwards of nearly 80% fully vaccinated. And we see these numbers here in our lower age groups, 16 to 17 and 18 to 24, with only about a quarter of those being fully vaccinated. But here you see 49% of receiving at least one dose. So you would assume it's an intent to get fully vaccinated. But those numbers, could be improved.
Now, question, have you seen where persons are only receiving one of the vaccines and not coming back to get the second dose? Has that been an issue here in Connecticut?
In Connecticut, it may be more of an issue. Locally here at our clinic, we do see the majority of our patients are completing their vaccinations.
Okay.
There is a very strong outreach effort to reach folks who are due for their second shot and have a scheduled appointment to confirm that they're coming. There's a way to call them. There's a whole process in place by which to really track these people down. And that second dose is critical. And it's something that really enhances the efficacy of the vaccine. And so it's something to keep in mind, that getting that second shot is how you get fully vaccinated.
Right. I raised that question because there has been so many myths around. If you had COVID, you really only need the first shot. But again, when in the testing stage, what they discovered is that the efficacy, as you stated, is only guaranteed in terms of the percentage if you have both doses. So Pfizer is 96, I believe, or 95. Moderna, I think maybe 94, but that's only with both doses. It's not that you get the first one and then you don't go back, even if you had COVID. So there has been a lot of certainly myths around both doses, and I'm glad that you raised that. It's important to get both. Absolutely.
Yeah, there's some small kind of studies being done on that very question. If you had COVID, is one shot enough? But like you said, we just don't know. And so we very heavily rely on CDC guidance. And at this point in time, they continue to recommend 2 shots. And regardless of your prior COVID history, that may be something that comes out down the line. But again, we don't know enough yet. And we're very humble in stating that everything is new with COVID.
Yeah, absolutely.
So just to talk a little bit more about the Pfizer vaccine for 12 to 15-year-olds. So the FDA did authorize Pfizer for emergency use authorization for individuals aged 12 to 15 on Monday. The ACIP met today it's a CDC advisory board, and they did issue emergency authorization. They agreed, so to speak. So the governor just sent out a communication that 12 to 15-year-olds in the state of Connecticut can now get a Pfizer vaccination. We will be starting to vaccinate 12 and above starting tomorrow, and that will be true around the state. And parental or legal guardian consent will be required prior to vaccination. And how that process works depends upon where you are going to get vaccinated. So it's something to check when if you're scheduling an appointment for your child. If you're going for a walk-up appointment with your child, then the consent forms will be available on site to fill out when you were there. In terms of the safety and effectiveness, the FDA made this decision based on a study of about 2,200 children between the ages of 12 and 15. The trial is ongoing, and what they found is that the vaccine was 100% effective in preventing COVID
Wow.
in the vaccine group. And I like to say that hardly anything is 100% in medicine, so that's pretty darn good. We thought 95% was good for adults, so at 100% is fantastic. So it's a really effective vaccine for this age group. And they're still looking at the ability of the vaccine to prevent transmission from person to person. That's something that's also being evaluated in adults and most likely is the case. And then similar to adults, there's questions around the durability of the vaccine. How long is it effective? Will we need boosters? When will we need boosters? But what we know now is that this vaccine is safe and effective. The most common side effects that were seen in the clinical trial were similar to what we're seeing in the adult trials and anecdotally through our adult folks that have been vaccinated through our clinics. Pain at the injection site in the arm, fatigue, headache, chills, muscle pains, fever, and again, usually resolve within 24 to 48 hours. Tylenol can be taken. And side effects seem to be more common after the second dose compared to the first. Similar, again, to what was seen with the adult trials and with the real live data that we see day to day.
Let me also interject, if you could stay on that screen. So again, more, I don't know if I want to call them rumors or myths or what have you, but in relation to Tylenol, some persons have been told that they could take Tylenol before the vaccine, and then some have been told they should not take the vaccine or should not take Tylenol prior to receiving the vaccine, but they could take it after. Have you heard or do you know what is best to take it before? Some say they take it before to ease maybe the side effects to come, but then they were saying that it kind of does not give the opportunity for the vaccine to be effective if you take it before. So what have been your findings on that?
Yeah, it's a great question. So I think a lot of that unknown stems from the fact that there's a question as to whether taking medication like Tylenol can blunt the response of the vaccine, exactly like you said. And more so the concern is about taking like ibuprofen, Advil, because those are anti-inflammatory agents, whereas Tylenol is like a fever reducer. That being said, the CDC clearly states that there's no recommendation to pre-medicate, so to speak. So, not to take Tylenol thinking that, oh my gosh, I'm going to get run over with side effects. But it is okay to take Tylenol afterwards. They do recommend avoiding to take ibuprofen or any type of anti-inflammatory agents within the first 24 to 48 hours after receiving the vaccine. Again, because of this question as to what effect that has on the vaccine's uptake into the immune system. And again, it's just one of those unknowns. And so to play it safe, we say take Tylenol as opposed to Advil, as long as you don't have any, significant contraindication to taking Tylenol.
Right. And so the children Tylenol, I think it's 12, ends at 12. And then is it where the adults, at what point can children go to adult Tylenol, or is it up to 12, I think, or 11? It might be 11. I think the liquid is 11, I believe.
Yeah, it's on the package on the package of Tylenol. But if there's ever any question about the dosing of Tylenol, then obviously it would warrant a call to the pediatrician,
Sure.
and just make sure that you're giving your child the proper dose.
Right. And then another question in reference to the booster. So that's been a question that I think many people have asked as well. Is this something that will be having to get done every year when they go to school, or even those of us who are adults? Is this something every year or twice a year? What has been the latest on that?
Yeah, again, another unknown. It's a very good question. I think my personal opinion is that we would perhaps need boosters of the vaccine to address variants. So if I'm sure people are aware, watching what's going on abroad in Brazil and in India, and we're seeing these different strains of COVID that are ravaging those countries.
Mm,
And scientists are really looking at the efficacy of this original vaccine against all of the variants. What we do know is that the Pfizer and Moderna vaccines, the vaccines that we use in the United States, are effective against the UK variant as well as the South African variant. The UK variant is the one that's circulating most in our community in Stanford, as well as in the state, and mostly, nationally.
mm,
But our vaccines work against those variants. The question becomes about their efficacy against Indian variants, Brazilian variants, and perhaps that's where boosters will come into play to say, okay, we're going to protect you against these other types of strains of COVID. It's
right.
possible that that may be the case in the fall, where they say, look, now it's time for everyone to get their second dose. It's unclear. I do
Right.
think that these vaccines last a long time. I think that the duration of immunity is good.
Right.
And they're actively studying that from the original clinical trial participants. It's been almost a year now from the original Pfizer Moderna studies. Those started last summer. Um,
Wow.
to measure those immune responses and say, okay, are they still immune? Are they still immune? So it's fascinating to think about, but that's the beauty of science, because we continue to learn. But
Yeah.
those are ongoing questions for us as well.
So that whole 6 months that we've been hearing, and CNN and all kinds of news media outlets have been sharing 6 months, but that is not at this point factual as we know it yet.
Yeah, if you think about it, I think that story came out when it had been approximately 7 or 8 months since the original trial started. Right? And so, in
Mhm.
terms of collecting that data from those, just and say, okay, hey, we're still good at 6 months.
Right,
But at this point, I get this question a lot. I don't want people to worry that, oh, I got my vaccine in February, so now the clock's ticking. Am I not going to be protected by August? And I
right,
don't think that that's the case. I think it's just it's just a matter of figuring out when a booster is needed. But that information will come from the CDC and from the state and all of these kind of these governing bodies and stuff that are looking at this, because I think it's clear that the vaccine is crucial in putting the end to COVID. As we see here in our state, we're enjoying now good numbers because our
right,
vaccination rates are so high.
right. And then I don't know if you covered it or you will later on another slide, but once you get, let's say they get the vaccine this weekend. What is the time frame? Is it the next 4 weeks that they get it, the second dose, and after the second dose, what at what point are they fully covered? Is it 2 weeks after the second dose, or what is the time frame?
Yeah, good question. So the Pfizer doses can be spread apart by 21 days, so 3 weeks, and anywhere up to 6 weeks.
Mhm.
So, if you get an appointment in 4 weeks, that's okay. 5 weeks is okay. But the soonest you could get your child a follow-up appointment would be 3 weeks. And we say that the vaccines are fully effective 2 weeks after the second dose.
Okay.
Look at a calendar, you've got, 5 weeks from at the minimum from the date that your child starts their vaccination series.
Hmm. Great. Great. Sounds good.
Okay, so I just have a few more slides. This is just, and I think Dr. Jackson's going to kind of, talk about this towards the end of the presentation, but how do you get a COVID-19 shot? So there's many, many ways. And this is through Stanford Health, how you could receive one or sign up to get one. There are appointments available through our website, www.stanfordhealth.org, and there's also a phone number here listed. The picture on the right is our Elmcroft vaccine site that's down by Harbor Point. It's our mega site that's been up and running for the past couple of months now. And that's where you can either get a vaccine appointment there or at the Stanford Hospital. We also offer walk-up vaccinations, and that's at Elmcroft. So the address is 1 Elmcroft Road, Monday through Friday, 8 to 5. You can walk up with your child, 12 to 15 years old, so that's an option as well. Again, in terms of the consent process, if you schedule online, there will be a consent form available to fill out online for your child. And if you come for a walk-up vaccination, the consent forms will be available at the vaccine site. This is from the City of Stanford Department of Health website. Also, an abundance of information about access to vaccines. This is just some screenshots from the Free City Park vaccination clinics. They have mobile units going to parks and to vaccinate folks and make it easily accessible. So that information is on www.stanfordct.gov. There are also pop-up vaccination events, and you can see here at the bottom, this is just an example through the Stanford Y, Stanford Excellence, Building One community vaccination events. And so there's a lot of information. I think the state's goal was to make it as easy as possible for people to get a vaccine, and the access to the mobile clinics as well as walk-up appointments, I think has been effective in doing that. So, you get your vaccine, you're fully vaccinated, it's been 2 weeks, and so now what can you do? And so there's some upside, and these are things that you can take advantage of by getting your vaccine. So you can safely spend time indoors with other fully vaccinated people without a mask, without social distancing, so you can see those good friends of yours and have them over for a meal and hug them and see their faces without masks for the first time in a long time,
Yes.
which is amazing. And the same holds true for extended family. Even if they're not fully vaccinated, but most of them are, but about their exposure. But the safest situation is if everyone's fully vaccinated that can be. You can travel domestically. You don't need to quarantine or get tested when you come back. So you can, head on over to Florida for a vacation that no one's taken in a year and a half and come back and not worry about quarantining your child from school or getting them tested, which is great. And, when you're outdoors, you don't need to wear a mask unless it's a very crowded situation. So, for example, a concert, or a crowded public event. But if you're out for a walk in the park, or if you're at the playground with your kids and it's not crowded, you don't have to wear a mask if you're fully vaccinated. But you always want to keep a mask in your back pocket, just in case you get into a situation where you can't socially distance. If you're exposed to someone with COVID, you don't need to quarantine, and you can still be around others, and go to work. And Dr. Lucero always likes to say that if you're fully vaccinated, you won't be required to quarantine if there's an exposure at school. So that's an incentive for our high schoolers and our students to get tested. And then in terms of traveling internationally, you can travel without needing to quarantine. Although you still should get tested and you kind of have to follow the rules of the country that you're going to. They have their own requirements. So pretty good. There's pretty good incentives here to get vaccinated and get your kids vaccinated, because it just makes all of these types of situations and social gatherings much safer.
Absolutely, absolutely. Let me go to a couple of things,
Yeah.
a couple of questions that came in. What about those individuals, those mothers who are still lactating and nursing?
Mm-hmm.
What is and this is not in the age group of 12 to 15, but
Right.
just in terms of those maybe that have not gotten vaccinated because maybe they are nursing and they have some questions. What would you say to that?
Yeah, it's a very common question that we get. So at this point in time, there's no evidence to suggest that the vaccine has any sort of negative impact on the baby that's being nursed by the mother. If anything, what we know from other vaccines is that getting vaccinated while you're breastfeeding is beneficial to the baby, because the baby gets all of that immunity, or not all of it, but a lot of that immunity through the mother's milk. And so the similar situation
followed by
holds
the pound
true.
or hash.
Mm-hmm.
If you do not know your option, please enter pound or hash.
Oh, that's the conference call. I
Sorry.
apologize.
So a similar situation holds true if a mother has a cold, for example, and is breastfeeding. The best way to prevent the baby from getting the cold from the mother is to continue breastfeeding, because those antibodies kind of go into the breast milk and the baby ingests those. So we support and recommend vaccination for lactating mothers.
Now, in reference to how long should a mother or will it take for the baby to receive the full vaccine or the full through the mother's milk? Like is it something they do a couple months, or let's say they do it for a month? Like how much will that be given to the baby?
So at this point in time, I don't think that there's any specific data on that. We're just going based on how we know other vaccines work. And so, so the amount of immunity the baby gets is unclear. When that happens is unclear. But what we do know is that there's
Or how much, rather?
there's little downside to getting the
Mhm.
vaccine when you're lactating.
Got you. So it doesn't matter how much they receive. It's just when they are nursing, they could have passed it on to their baby, some type of protection.
Correct.
Right. Okay. All right. Sounds good.
All right. And
Okay.
this is my last slide.
No worries. You're doing great. You're good on time.
Just to try to project the future, because that's always a question we get, right? And so this was a nice study that was published in MMWR through the CDC. And this looks at different scenarios, and they did some modeling to determine, like, where are we going to be in the fall? What's going to happen in September? And you hear all these things on the news. Oh, we're going to see another surge in the winter and this and that. But I think safe to say we have to be comfortable saying that we just don't know. But if you look at the science of what we do know, it's portrayed in this graph. So this looks at the number of cases per week. And you can see this arrow right here. This is April. So this is looking June, July, August, September, looking forward. And the number of cases per week is projected to be the least if there are high vaccination rates and moderate NPI. And NPI means non-pharmaceutical intervention adherence. So non-pharmaceutical interventions means what we've been doing for the past almost year and a half. So the masking and the social distancing and the hand hygiene and all of those measures that have been put into place. That, if you have a community with a high vaccination rate and even moderate amounts of masking and social distancing, you can see what happens to our cases of COVID by the fall. It's virtually nothing. But this black line here looks at the projection if you have low vaccination rates and low adherence to masking and social distancing. Obviously, you would expect to see a higher number of cases. So I think vaccination is really our way out of this, and it's our way back to some semblance of normalcy, and we're starting to kind of feel that now in the state and locally here, that with our number of cases coming down, and but we're not 100% there yet, and so that's why it's important to encourage vaccination for those who have not yet been that way. And for children, I think it's great, because I think it will really help define the school year for next year, starting in the fall. What are the decisions that are going to be made about masking in our middle schools and our high schools? And if there's a high vaccine uptake, as you can see in this graph, you would predict that there would be a low number of cases. So again, the questions that need answers, we kind of already talked about: booster doses, revisions to the vaccines to address variants, and then also the development of antiviral medications to treat COVID when it does occur, for people who get sick. And so that's something that we're still learning about as well. So I will end there.
No, I think it's excellent. Great presentation. What would you say still to some parents who are still on the fence in terms of, the numbers were only the trial was only given on 2,200 children. What would you say with that in terms of maybe some parents that still might be a little cautious?
Yeah, it's a good question. I think that the data that we've seen so far in adults can be translated to what we would expect to see in children and adolescents.
Right.
The country has given over 200 million doses of these vaccines, not only Pfizer, but Moderna, Johnson & Johnson. And I think it's very clear from the data that these are safe. And again, the original trial participants from last summer were nearing a year, and we haven't heard of any sort of significant adverse events even a year out. I do think that there is a little bit of taking a leap of faith, and I get that, right? As a parent myself, you always want to make the best decision for your child. But something I think about a lot with my kids, at least, is that, the thought of them potentially going back to a school in the fall and not having to wear masks every day, right?
Yeah.
I mean, not that would necessarily happen in the fall, because we need to get the younger kids vaccinated as well.
Yes.
But even for high schoolers and middle schoolers, I feel that there has been a tremendous impact on kids' mental health.
Yes.
Because of a lack of socialization and the need to distance learn. And I think that we have a lot of cleaning up to do, and not only just from COVID, but just in general, their well-being. And I'm sure you can relate to that, being a dad. And so if for anything, it's our way to get back there and get the kids feeling normal again, and being able to hang out with their friends and have sleepovers and not worry about, Tommy's going to test positive in 2 days, and then where everyone's on lockdown. There's none of that. So, and it's also, I think, important to talk to your kids about it, especially kids 12 to 15, because they may tell you that, look, Mom, I'm sick of wearing this mask. I'm sick of, having to sit behind a partition in the classroom and not eat lunch with my friends in like a normal way. This is the way that we can get beyond that.
Yeah, I think that's great information. And I think, and one of the things I'll put a plug in now, we're working on a flyer, but the Stanford Public Schools are going to host a mental health forum on the 27th of May. And we'll be dealing with some of the mental health aspects that many of our children and parents have had to endure throughout this last 14 months or so. So I think, while there is certainly, I agree, a leap of faith, we took it even as adults, again, but as our dear children, our babies, even though they be 12, it is important. I think while I think my children have done fairly well, and we were totally distant learning because we have a newborn, or we did. He's 1 now, but we didn't want to risk taking our children 7th and 9th graders back to the school, something would happen. Again, quarantining and all that, how that will look for us, it was just not for us, not worth the risk. And so we sacrificed, and I was able to obviously work from home and also do what I need to do to help them. But vaccines I think, will be a critical aspect of them going back to school and not having to worry about, again, as we said already, getting the virus at school. And again, teachers, I'm sure my wife is a teacher, so it'd be certainly great to see kids without the mask on, and it is wonderful. I'm excited, and I certainly thank you for taking the time out tonight and sharing with us. Are there any questions for those who are on Facebook? I'll just share a couple of Marie Hollingsworth. She said fabulous information. She works at the Stanford Hospital, and she's a social worker there. So I'm not sure if you know her, Dr. Shah, or not. And also Sister Angela Edwards, who is a teacher as well in Stanford Public School. She says very informative. We're certainly glad. We'll give a few more moments in case any others have again any questions. YouTube, there's some watching on YouTube. No questions have come through yet on YouTube. And then, of course, conference call. We haven't seen anything yet. And my wife says, thank you for this information.
You're welcome.
Yes.
Congratulations.
Yes. So again, this will be broadcasted or available even after tonight. Again, you can see this on our YouTube channel, Bethel Church of Stanford, or again on our Facebook page. And so we invite you to even share this broadcast so we can get the word out to parents and again to guardians who are looking to have their children vaccinated, or even adults as well. In closing, I will say that immediately after this broadcast, I will share the information for May the 22nd and the link to register. We will have walk-up opportunities here at Bethel Church for those who do not register or did not register online. We'll have a separate line for walk-ups. And then those who register. It does not necessarily mean that you schedule an appointment at 11 o'clock. You're going to come in at 11, get it at 11. It still may be a little waiting period, but again, we'll try to make sure that we are getting you through the line as quickly and expeditiously as we can. We're working with the Community Health Center and certainly others to have this process smooth as we've done before. We've learned, Doc, every time we've done it. We've learned best practices. And again, as I shared prior to coming on live, we're meeting constantly. I happen to sit on the committees, and so I think it's a great thing. We're meeting to kind of tighten up the process and getting things as smooth as we can. So we're grateful for the partnerships, and even again, just a shout out to Laura Jordan, who connected us together, and also Laura Berwick from the city of Stanford, who is doing an amazing job with education and all kinds of good things that are coming down. We're looking to also receive the call today. I'll have more information about it in the days to come. But as we get closer to the summer months, it will be an opportunity for possibly us to have persons to canvass the neighborhood, knock on doors, and ask persons if they are vaccinated or they're not, and then sign them up with an iPad right on the spot, and then connect them to where they need to go. They will be paid positions. Obviously, there will be some training that will be needed. So we're looking to do that in the near future, really the next couple of weeks. Hopefully we'll have information about that. So persons in the area could knock on doors and sign people up. So we're taking a real aggressive approach to try to get the word out and to get persons vaccinated. So again, Dr. Shah, thank you so much. And look forward to meeting you in person in the near future, as we're neighbors right up the street, hospital. So thank you so much, and may God bless you and continue to keep you and your family safe. All right.
Thanks for having me.
All right. Take care.
All right.
All right. And so again, we thank all of those who have tuned in tonight. We're excited for you, and we pray that you would continue to, first of all, again, ask God to guide you and to certainly pray about any decision you might make. Thank you, Sister Bridget. Sister Bridget says, great info. Glad we're able to share. Absolutely. And so, again, if you have questions, you can certainly contact the church, email the church, call the church. We can put you in contact with who you need to speak to in regards to the vaccine and even appointments. Again, you necessarily don't have to wait until the 22nd. There are opportunities for drive-through in Stanford at Lord and Taylor, but you can also come to the church on the 22nd. So if you can wait that long. And again, the good thing about it is it's only 3 weeks after your first dose to get the second dose. All right, so we're excited, and we prayerfully this will be putting us back on the road to continue what we know that we like to do, particularly in the summer months. All right. So again, I would like to just say thank you everyone who joined. Let me just offer a word of prayer, and then we will dismiss. God, we thank you for the information that we've heard tonight. We pray that it be a blessing to those who are watching, and God, to help them to make the appropriate decision for them, for their family members, God, whatever it is that you have given them. We pray blessing upon our first responders, our nurses, and our doctors as they continue to care for all those who are impacted by not only this virus, but other things. We pray again for clarity. We pray for for the scientists as they continue to share and reveal the latest technology and all the things that are happening around the world. We pray protection upon them and their family. Bless us all and keep us. In your name we do pray. Amen. Well, God bless you all. We are signing off, and we let you again get back to enjoy the rest of your evening. God bless you, and we'll see you again on Sunday for worship at 10:30, parking lot worship, pull-up parking lot, and also 12:30 for call-in conference call. God bless you. Thank you so very much. God bless.